Okay, we are recording. Well, thanks again for joining us. I am going to share my screen here to get us started. Okay. Slideshow. Okay, well, hi everyone, and I want to formally welcome you to the Regional Oral Health Connection Team onboarding session for 2022. So to get us started, okay, here we go. Let's do introductions. If in the chat you could add your name, state, and organization. And while you're doing that, I will formally introduce myself. For those who I haven't had the chance to meet yet, my name is Bianca Rogers. I've worked in the oral health space for about 7 years now, primarily in policy advocacy work. Through the CareQuest Institute for Oral Health and also through Open. You will be seeing a little bit more of me through Open this year. I'm taking on some network support responsibilities, including that with the ROHCT, which is why you'll see me here today. So I am here to support all your needs and coordination in the ROHCT. And so while you're getting yourself situated as well, I want to go over our desired outcomes for today. So by the end of this call, I want you to leave knowing more about Open's focus for this year and how you can plug in as a ROHCT member. And more, I want to be able to answer any of your questions and clarify questions around your role and expectations for this year and how we'll be working together. And so with that, I also, as you have any questions throughout the presentation, feel free to pop those in the chat. I will say, if you don't see me responding to that, it's because I can't see the chat while I'm presenting. But my colleagues on here will either respond to you or we'll get to it when we're just sharing, we're not screen sharing, but I promise to get to it as you have questions. I'm not ignoring you. So let's get started here. I should try not to mute I need to move. Okay. Sorry about this. There we go. So let's first get grounded in our conversation today. I wanted to start off about, I wanted to start with showing you the Open as a multi-hub network, and you'll see the various hubs here on your screen, including the ROHCT, where all of you are lie. And I just wanted to use this to remind us that the premise of Open as a network is based in the theory that systems change is possible and most effective through collective action, which leads through collective impact. And so for those of you who are either newer to network theory or want to learn more about Open's history, I really encourage you to participate in the orientations that are held monthly, and we can provide you with those specifics in follow-up, because today we're really going to be going into more of the detail and not necessarily reviewing a lot of Open's mission, vision, etc. So I do encourage you to take the opportunity to do orientation if you haven't done so. And you're also free to reach out to me and we can connect one-on-one if you have more questions about that as well. Okay. So the other thing that brings us together is that there's this shared notion of oral health as a social justice issue within the network and as an equity issue. So I wanted to highlight Open's definition of health equity. This was created by a group of network members a couple years ago, and it really serves as the foundational building blocks to our work. So the way that we use this definition is it drives all the functions within the network. It helps us hold ourselves accountable when we are convening, when we're hosting meetings, when we're setting our goals, when we're thinking about what legislative policies to support. And so I wanted to share this so that we are all starting off on the same page in knowing that the core of what we're working on is oral health as an equity issue. And so specifically today, I want to talk about you, the ROHCT Hub, and how you fit into the network. And so as you can see, the ROHCT is made up of grassroots reps as well as state reps who are the voice of open within their states, and then ROHCT leads who are those who kind of rally us and corral us together, right? And what I want to do next is dive a little bit deeper as to who the ROHCT is within the networked, and they are the network weaver, and this is such a critical and important piece of the network. And so I want to read this definition, and I hope as you're seeing it, you think of, oh, you know, that is who I am, and that is the value I can bring to this group. So network weaver is someone who is aware of the networks around them and explicitly works to make them healthier, more inclusive, bridging divides by connecting people strategically where there's potential for mutual benefit, helping people identify their passions, and serving as a catalyst for self-serving groups. And so what that looks like at Open is you are sharing resources and offerings from Open with stakeholders that you know. You're encouraging them to become a part of the network. And then on the flip side, you're sharing back with Open needs, resources, and opportunities in your state and communities. And so I just want to take a moment now, and in the chat, I know we have both alums on here and people who are new to the network. And so I'm hoping you can add to the chat, if you are a seasoned member, an example of how you have been a network weaver to Open. And if you're new to the network, maybe what you hope to do as a network weaver, something aspirational. So you can go ahead and add that into the chat. Okay. So now that we've talked at a high level about Open as a network and your role as network weavers, let's get into the specifics for 2022. So the theme for 2022 is the blueprint, at least for Open. This is our holy grail, so to say. And I want to share where we are in the process for developing the blueprint and how we got here. I recognize that for some of us, this may be a review, but I think it's important for all of us to be on the same page and have the opportunity to ask questions and get clarity on it, since this is really going to be the focal point of all of our work moving forward. And so the blueprint is going to be used to inform the network strategy for the next 5 years. And this is the method that we are using to fundamentally alter the oral health care system. So the first step in developing the blueprint was for the network to determine what it hopes to accomplish. And so here's the aspiration. As a network, we hope to create an equitable, affordable, and accessible oral health system that produces quality outcomes across the lifespan. And so mapping out the next steps after we've come up with that aspiration was to map out the oral health system as it currently stands. And so a group of network members came together to do this work. And what was realized was that the healthcare system as it currently operates is as a business. And the other thing that was noticed was that there was inadequate infrastructure to best meet the needs of marginalized groups. And so mapping out the system allowed for the network to see gaps, or if you have optimistic eyes, opportunities for change. And so those opportunities or gaps became known as the areas of leverage, or our leverage areas. And so those are to amplify consumer voices, to advance oral health policy, to integrate dental and medical, to emphasize prevention, and to bring people to care. So I want to take another second here to pause and see, think about in the chat, maybe put what in your given typical workday, which of the lever areas do you work in mostly, and maybe which one are you most excited to see actual progression on and movement in. And I hope all of us at the end of this, well, after many, many times hearing this repeated, we can name the 5 levers without having to look at this sheet. I'm getting there soon, but still work to be done around that. So now that the lever areas were designated, a group of network members again came together to brainstorm all the different strategies possible in order to move and progress the work forward within these themes. And so that is this next step that you see here. And once those strategies were refined and finalized with network input and feedback, each of them were assigned action steps. So actual concrete steps on how we can make this happen and how we can actualize the work. And so here you'll see just a high-level summary of what we went over. So those steps that we just covered are what we've done so far in putting together the blueprint. And what's in progress for this year is those action steps are going to be prioritized among the lever leads, which is a new hub to open this year. They are going to be brainstorming and assigning measurements to each of those action steps and coming up with a implementation plan and evaluation structure so we can hit the ground running in 2023 to actually implement this. And so throughout this year, you will be hearing from lever leads on ways that you can provide more input and feedback in this. And we are excited to see this operationalize. And thank you for many of you who are on this call for providing that feedback and input that you've already done. So I want to stop actually now and see if there are any specific questions about the blueprint itself. And hopefully my colleagues might have answered some of the questions you have. I'm going to see if there's anything coming out. Great. Oh, yes. Thank you for putting in the areas that you're working in. That's exciting to see. Okay. Well, if there are no huge questions of clarification, we can move on now to say where your role comes in. And so here's where we think that you can come in as a network weaver. We hope that you can identify and engage key stakeholders in your state for each of the lever areas and think about whose voice needs to be at the table. This is a major undertaking, and so we need to think about the expertise needed at the table, the constituents needed at the table to make this happen. And so, of course, you won't be alone in doing this. We will be there to provide you with resources you need and materials on how you can communicate the blueprint to others, exactly what we're looking for in people that you bring to the table within these stakeholders. We will be here every step of the way to accomplish this. So knowing that more information is coming, does this concept seem doable, reasonable? Maybe we can get a thumbs up, sideways, thumbs down. We hope that this can become kind of a goal for all of you to be working in this year. So let me check. I can't see you all, so hopefully you are giving some thumbs. Okay, I'm seeing a few thumbs up. Excellent. Thank you. Oh, great. Well, we appreciate that. So we'll be talking a little bit more about this as plans are underway, and a very detailed summary of exactly what we're looking for. But we just wanted to start with the concept here and say, okay, if this was not going to work at all, how would we need to revise? So appreciate your willingness to do this. So now we want to talk about another piece that we are looking at this year that falls within the context of the blueprint, and that is the fact that it's an election year. And so midterm elections are coming up this November. The policy NRT has had some initial conversations on tools and resources that they can be developing this year. Given the fact that last year oral health had a pretty monumental year, I would say. It was talked about a lot in the media. We were very close in making policy happen. And so we want to keep up that momentum this year. And where we see your role within this is once those resources are ready to be used and are shaped up, that you would share them with other stakeholders in your state, potentially do some coordination among members in your state so that you're engaging legislators and policymakers to the best that you can. I want to stop and see if there are any questions about that. Okay, I'm opening my chat again. Okay. Okay, great. And I will get to some of those questions at the end in terms of, I see there was a question about clarity on if you were a state or grassroots rep, so I will circle back to that. So now another piece of open, in order for you to successfully accomplish the work, it's up to us to bring you all together and convene our groups. And so I'm hoping you will take 2 minutes to fill out a survey that Francis is going to put in the chat. I'm going to stop my share here. To tell us your preferences on convenings for this year. And then once you're done filling out that survey, just come back here and either give a thumbs up or say that you're back in the chat, and then we'll know to move forward. Oh, could one of my open colleagues email the link to Sue when you get a chance? Thanks, Francis.
Yep.
Are people mostly finished with the survey back? Yes, seeing a lot of head nods. Okay, excellent, done. Okay, great. Well, okay, here we go. Well, thank you for taking the time to fill that out, and we'll have more information about convenings coming out very, very soon. So here are just a couple of miscellaneous or additional asks that we have for those who are in the ROHCT. We ask that you participate in your regular regional calls. We ask that you communicate via open communities. There is a new ROHCT forum that we hope to be utilizing, and Francis is going to show us how to work that and some upgrades you can do to your profile in just a second here. We also hope that you'll use open communities not only to communicate amongst yourselves, but also with the larger open wide community about information, resources, story submissions, etc. We're looking for you to also encourage leaders in your state to join open. There is a engagement I don't want to call it a toolkit. I think it's a guide, but that is being updated for you to be able to utilize to succinctly talk about open and how to get involved and who we are. I know it is quite complex. I know it can be quite complex to talk about the blueprint and what we're trying to achieve. And so we hope to come up with brief materials that make it really easy to do so in more of like an elevator speech type. And then also, as much as you can attend and participate in open meetings and following us on social media, we always appreciate that as well. So I will stop now so Francis can show us the new open communities. I do recognize some of us may have had challenges with re-logging into the new system. And if you're still experiencing challenges, just reach out to me, or if you put it in the chat, I will reach out to you.
Cool, thanks. Hi, everybody, and welcome back. Happy ROHCT launch. So we now have a new home, open communities. We have a little bit of a new look and feel. So I hope you guys have been exploring around over the last couple of months. So this platform gives us a better way of tracking everything that we're doing and who all's participating. So I just want to take a couple minutes to show you around for where you can communicate with the network at large, where we will communicate with you as ROHCT specifically, and where to find some key things. So when you log on to communities.openoralhealth.org, it will take you to this landing page. You'll be able to see some community discussions, which you cannot interact with right here. This is just the feed, but you can go into the communities to contribute to the discussions and interact with those. You can also see the open events right here, what is upcoming, which will include the next member orientation. As Bianca mentioned, if you're not steeped in all things open, you can join us. I believe we do those every third Wednesdays, but check the open events, it will be there. So when you're ready to interact with others, you'll go into communities. So you can click that here at the top. And once in communities, you'll see the open wide community. That's where every single member is in there. So if you go into a community, every single community is modeled the same way. So you can see some basic details here. I am a member. You all should be members as well. And so if I want to change my subscription preferences, right? So all of the daily digests that you all receive in your email, if you want to see that less frequently, you can select weekly digest. If you want to see an email for every post, instead of just that summary blurb, you can select every post, which is what I do. And I like to stay on top of what everyone's up to. Or if you're like, no, you know what, I don't want the chatter, I just want to limit it, you can do that. So that's how you change your subscriptions. And that's the same way for any community that you're a part of. So again, this is the open wide community where every member is there and you can post any kind of question, poll, start a discussion, share a resource, whatever it is that you're thinking, that would be great. Another new feature is this poll. which is cool, but we'll get into that another time. So for the ROHCT community itself, you'll scroll down from the community's main page. You can see all the different network response teams that you're invited to join. They're all open and issue based, whatever your interests are. So here in the network infrastructure, right, you are formal leaders. You guys are the ROHCT hub um, uh, for our network infrastructure. So all ROHCT is right here. So if you go into your community, all of you have been added into this community, so you should already have access. Again, set your preferences for how frequently you would like to stay in touch. I would recommend every post. Um, and also just a note that we're aware for everybody, the daily digest that comes through, there is a link to click more to be able to log into the thing and see the full post, and that link is broken. We are working on that, just as a side note. But so we have the all ROHCT community. ROHCT leads also have a community if you want to connect with one another. The ROHCT leads is all right there. And so those are private communities. That's for things that are more internal to the ROHCT and is how we will be communicating with you. So make sure that everything is all checked out. You know your way around open communities and have your subscription preferences set. And the final thing before I hand it back over that we're asking for you all to do is to go into your profile, which is this button right here, and then upload an image, which you do just by hovering over the image icon, and you can click that and drop a photo in or click in and upload. And then if you want to edit your profile for any additional information, but we intend to update the leadership page on the open website to include all of your information. So we are asking for the headshot and the update for that. So if there are not any questions, I don't know how I'm doing on time, but I think I can turn it right back to Bianca.
Deb says serious photos.
No, of course not. Any old photo you want to share?
Yeah, exactly. I'm curious to know what photo you're thinking of, Deb. So please post that one.
I also feel like I shared my profile to ask you guys to upload a picture, and I myself have not. And I almost feel like I just showed you like my dirty laundry. I'm like, oh my goodness, did I leave that there?
I was thinking the same thing because I too do not have a photo at all in there. So we are all on the same page, everyone. Francis, Tanya did have a quick question about why do we know why open digests come in the middle of the night? I think that's an automated thing, correct?
It must be automated, and I'm still figuring out how the back end works and setting the system preferences. So I'll make a note of that. I have like an issues log. So if you guys have things like that, you feel free to email me directly, and I'll put my email in the chat. But any feedback is valuable. So we want to make the whole experience as easy for you guys, like tear down the barriers, make sure you guys are able to access everything you need. So just let me know whatever it is, if there's issues or if there's ideas, keep them coming.
All right. Well, thanks, Francis. So, I know we're still working through the kinks of open communities, but we really do hope that you'll, make a commitment to utilize that as your communications platform, and we will do our best to make sure that it's working properly for you. So now we just want to take time to connect with one another. I do want to introduce you to your ROHCT leads. Like I said before, these are the individuals that are really rallying us and spearheading our work together. And so we are going to have the opportunity to break out in our regions. And so I want to go over the breakout prompts, and then I'm going to turn it over to Annalise and Bridget to talk about how they operationalize their meetings, so you can get an idea of what works best for their region, perhaps something you might tailor to your own. And so when we go into our breakouts, take a moment to do introductions if there are new folks in your region. And so because there are so many moving pieces to our work, I really think it's important for us to start from a point where we're setting a clear operational compass via team norms. And so in your breakout, you are going to develop your team norms. And for some of you, you have already been working within your team. So perhaps it's a time to reflect and renew what that contract looks like. And so how we'll do that is I want everyone to think back to an experience where you were on a team and it worked well and your outcomes were successful, and to share out one team norm that contributed to that team's success. So, for example, from me, I worked on, the best team I worked on was one that everyone contributed or participated. And so, one way to operationalize that is by how can you design your meetings perhaps to say, at minimum, could people, say that they agree with whatever prompt is out there? Maybe it's through the chat, maybe it's verbally, so that everyone is at least communicating. Or perhaps maybe you think, there are people who are extroverts and there are people who are introverts. So perhaps you want to split into trios or duos when you're tackling a brainstorm to get more participation. So think through some of those things. And then as your group, commit to 5 or fewer norms that you want to function within. And then also talk about how you're going to hold each other accountable if you don't practice the norms that you've agreed to. So that is your assignment, quote unquote, for today. And so let me stop my screen here. I want to turn it, is Bridget on? I'll have her go first. Bridget, are you with us?
Yes.
Oh, great. Hi, Bridget.
Hello.
So please share with us your wisdom. What has been working in your group?
Well, Bianca asked me to come on and share a little bit about what we're doing at the Northeast Mid-Atlantic region, and perhaps some lessons learned about the way that we're operating in the Northeast. And I see that there's a number of folks from the region on today, so I'm real thrilled about that and being able to chat in a few minutes. Northeast Mid-Atlantic meets every month for a half an hour. And we started this a couple years ago, and the idea was to sort of our original idea was to just sort of start updating people more on open and what was going on. And it's really become a forum for the people in the region to talk with each other and to learn, especially through COVID. There was a lot of information sharing. So this year we're taking an approach where we're trying to be a little more organized about how we do that sharing and what type of sharing, and getting and plan ahead a little bit more for that. So we started by doing a survey of the members, and we've come up, basically split. People want to learn more about open, more about their role in open, share more and learn more from each other about how they're handling their roles in open, and be more topics and have time for topic specific conversations as well. So and they gave us a list of topics they'd like to cover over the next year. Some of it is open specific, like more about the blueprint. How can they be involved in the blueprint? What are how can they be involved more in the levers? How can they operationalize this within their states, plus other things like telehealth and how other states are handling it. So we're going to try to come up with a structure to get that to arrange the meetings for the coming year in a way that provides them what they need. Sharing it's a great group. And I guess some of the things that we've learned is that we need to make more connections from state to state. We need to be more strategic about how we bring in the open strategies and levers and make sure people are working in those areas. And also, it's a very great group. It's exciting. People are very excited and about the work. And so we want to keep that enthusiasm going.
Great.
So that's where we are.
Thank you. I really appreciate you sharing that out. And I think, doing the survey sounds like a great way to operationalize. And so Annalise, are you also on the call, just to take a minute to say how you've organized yourselves. Let's see if Annalise, looking at my list here. Ooh, she might not have been able to join us today. Okay, that is not a problem. So at this point, Francis or Bianca, can you help launch those breakout rooms and everyone can get started in connecting and discussing your norms and how you're going to do the great work that you're going to do this year?
So I have the breakouts ready. I just wanted to make a quick correction on the ROHCT lead slide. I had Christian Moeller Anderson listed as the one of the West ROHCT leads, and it's Laura McKean. They decided between themselves, they're the grassroots and state rep for Oregon, and decided which one of them would step into the lead role. So just wanted to acknowledge Laura. And now I'm opening these rooms. And so you all can select which region you are a part of. And I know some of them are tricky, like Oklahoma is south-southeast, Colorado is west. So that works out. But if you have questions where you're going, let me know. Otherwise, you will be whisked away and talk about all of your group norms. And I'll make sure that we put that in the chat too. So are the rooms open? Do you guys see the way to connect?
No.
Yeah, so you can hit breakout rooms at the bottom of your screen and then hover over where you want to join.
Are you
And
seeing
then
breakout rooms?
you're not seeing it? People aren't seeing it?
No,
No.
breakout
No.
rooms doesn't show at the bottom.
You're not seeing it next to reactions?
No, ma'am.
Okay.
I'm gonna start assigning and we'll test my knowledge of how well I know your states.
It's a fun game.
Okay.
So we'll probably take about 10, 12 minutes in the breakout rooms, but we'll announce it to you all so you know how much time you have.
Bianca, while we're waiting, can you explain about the 5 norms that you're wanting? Can you give an example or two of these norms?
Yeah, so examples of norms are like the agenda will be sent, 2 days in advance of the meeting or a week in advance of the meeting. Another norm could be everyone needs to participate contribute on the call. So one way to do that is maybe you rotate who's facilitating your calls each month. That could be one way to do it. Really how you get to norms is think about a time you worked on a team that worked really well and it was successful. And what was it that you all did that made it easy to work with each other? So did you communicate through email? Did you communicate through chat? Did you, I'm trying to think of what other examples I might have here. Like being fully present, like shutting off your Outlook when you're on the call, having your cameras on, any open staff, any other ideas that come to mind of norms? Grace, Bianca, any norms that you like of when you're in a team meeting?
I always like the step up, step back, so if you haven't said something, maybe think about it. And if you're taking up some oxygen, maybe let others.
That's a good
I also now have exhausted my knowledge. So Donna Richards, I want to say Nima. Where am I sending you?
Yes.
Yes.
Yes, she's West Virginia.
Okay. Rhonda Switzer Nadasti.
She's, I think, Tennessee.
I think so, yep.
Nancy Brohan, I want to say Delaware.
Nima,
Nima.
yes.
Billy Lunt. No Billy's. Anu Shukla.
Midwest.
Midwest. Okay. Jennifer Hash. I want to say Arkansas, South.
Kentucky, Southeast.
Okay. Sorry. Bobby Will.
North Dakota, so I think it's Midwest,
I think
right?
North Dakota. I think you're Midwest, yeah. Okay, and then there's a 160-327-58269.
Billy Lent is Nima.
You've got Patty on Midwest, Ashley Herman Midwest, Christy Wells Midwest.
Oh, that's weird. I already sent them away.
Oh, they're still here.
Yeah, the unassigned ones. I see Annalise. Okay, she's
You would put mine as south or southwest, so I didn't join it.
okay. It says not joined, so I think there should be a button on your screen. There's a few that have a grayed out not joined.
I need the Midwest instead of the south, so I need to reassign.
Oh, sorry, I put you in the south and you're in the Midwest. My
I'm
bad.
the same way, Francis.
Oh.
Wow, hating on my Midwest
Tricky.
people, Francis.
I would throw you in the south. It's Missouri, you know? Come on.
No.
Okay. So did I do that to anyone else?
You got Bridget still. Bridget's Nima.
Yeah, and I see Elliot from Nima from Virginia. I see him in the chat too.
I'm Clarence Jones from Midwest, I believe, but I'm not. I don't see myself in any room.
I don't actually see you either. I hear you. Just for me. Get in the room, assignments.
Oh, wow.
You're flying under the radar, Clarence.
Ah,
Um,
from Minnesota.
Minnesota.
Kelly's Pennsylvania. I don't know. What is that? Nima?
Kelly, yeah. I don't see Kelly either. I see an SM-G973U. There's a couple of phone numbers. One's a 312 and the other is a 603.
We still have Rhonda. You didn't get Rhonda in her room?
I'm not in either. It's
Oh,
Paula. I didn't get anything to join a room.
we're getting there. Thanks, Paula, for your
Because
patience.
and you're going to the southeast, right, Rhonda?
She just went, so she's good, I guess. So now we have Paula,
Paula.
Kelly, Clarence, and Bridget. Bridget, you're still stuck with us?
Yeah, is that Paula Fisher? She's Nima.
Yep, that's me, Bridge.
Go ahead, Paul.
Am I supposed to be with you?
I think we're supposed to go someplace.
Oh, we
Be
love her.
nice.
Yeah, I don't see Paula at all.
That's so.
Yeah, I don't see you in the chat.
I see me and the participants.
No.
I see her. Can I, if I'm co-host, can I do anything? Probably
If
not.
you can get into the breakout room thing, maybe.
I have. Oh, you know what? Let me see if I can assign them a breakout. Put in waiting room. No, don't want that. Nope. I don't
Yeah, I
have.
don't see Paula or Bridget. And now we have Kelly back.
And Clarence. Well,
Do you guys want to talk about the group norms that you hope to see in your ROHCT group, and then we'll make sure that we get your ROHCT leads connected to that, and make sure that you can get your voice into the next one, I guess.
Well, Bridget is my rock lead. So anybody else, I don't know, is out there without a lead. That's supposed to be Bridget.
Bridget's gonna take all the strays.
Well, it's going to be interesting to see what they decide without any leads in the room.
Yeah. Maybe that, that is something to do.
Are Bobby and Sarah not here?
No.
I think that happened last time. Is it just something with us? I don't know.
If you want, I can jump into Nima, and I'm sorry that I can't make you go there, but I can make me go there. So.
Okay, well, you go and see what they're up to over there.
I'll circle back, relay. Bianca, text me when you're ready for me to close the rooms if I'm not already back.
Okay,
And I
well,
talk to Bridget all the time, so I don't know.
well, you get an unexpected lovely break with me. Can you just announce to people like when there's 2 minutes left and stuff like that? I'm thinking we should come back like in 4 or 5 minutes.
Sure. Okay.